Welcome back. The National Health Laboratory Service is reportedly turning to the private sector to ease backlogs in its cancer testing at its Johannesburg facility. It follows a complaint by DA MPL Jack Bloom, who visited the NHLS Histology Laboratory at Charlotte Maxeke Hospital in Johannesburg recently. For more on this, we are joined by the NHLS Executive Manager, that's Professor Elise Schapkaitz. Professor Schapkaitz, a very good evening to you. What a dire situation that the NHLS finds itself in now. I believe the backlog, the total backlog stands at over 14,000. Is that correct?
That is correct. So thank you for alerting your listeners to this crisis that we are facing in anatomical pathology at CMJ. This is one of 4 platforms for anatomical pathology in Gauteng. And it's one of our biggest units. It receives 4,000 specimens per month. Currently, we have a backlog of 12,500 glass slides. So these are specimens that are just waiting to be reviewed and reported on, as well as 1,500 specimens which are still in their buckets. They have not yet been processed. The NHLS acknowledges that this is a crisis, and we have all hands on deck in order to attend to this.
Prof, how did the NHLS find itself in this position with thousands in this backlog?
So since 2023, the NHLS has been experiencing staff shortages, and this has subsequently declined to the point that now in 2025, we are sitting with less than 80% of our staff complement. So at Charlotte, while we should have 21 pathologists, we currently have 4 pathologists. So we have 17 vacancies that we are advertising on a monthly basis. What we have, yes.
Sorry, you may continue. The 17 vacancies?
The 17 vacancies. So what we are experiencing is that newly qualified pathologists join us for a short period, but within the first year, 60 to 80% of them leave for the private sector. In addition, we also have a high volume of specimens, particularly specimens which are not urgent, such as placentae, which are also contributing to the workload.
So also when it comes to the retention of staff as well, who are now leaving the NHLS to go to the private sector as well, do we know why you aren't able to retain staff?
So it does really come down to the disparity between public and private. The private sector, and this is not just healthcare related, I think it's across all sectors, are able to offer higher salaries, better working conditions, better processes. So for example, in the last 24 months at the NHLS, we have trained and qualified 21 pathologists, yet we are still sitting with 17 vacancies.
Sure. And when you also write your reports for the Department of Health as well to also alert them of these challenges too, what kind of response are you getting?
So we have partnered with the Department of Health at both a provincial and a national level. So at a provincial level, the Gauteng Department of Health have formed a task team together with us. So this consists of committee members from both the NHLS and the Department of Health. The terms of reference are there. The strategy is in place to fill the vacancies, to clear the backlog. We are meeting again with them on Monday. So together with our partners, both the Department of Health and private, we hope to get rid of this backlog.
Prof, if you could just also paint a picture for us with these backlogs as well. What does it mean for an ordinary citizen who's watching this right now, who has perhaps gone for a cancer test? How long would they have to wait with the current backlog for those results?
So I want to calm the fears of all patients who are out there. All the work that we receive is prioritized, and all urgent work is attended to urgently. So up until September, all urgent work was being processed at Charlotte with a turnaround time for urgent specimens of about 4 to 5 days. This is also dependent on what the specimen requires. A lot of these oncology diagnostic specimens will require additional testing, and that adds to the turnaround time. because we are so concerned now about cancer diagnoses, we are now, in addition, sending all oncology specimens to the private sector. We will be sending 1,000 specimens per week to the private sector. Their turnaround times are unfortunately slightly longer than ours. They're sitting at about 7 to 10 days. But urgent work will always receive priority. Quality of patient care is the number one priority of the NHLS.
Prof, there are anecdotes of patients having to wait months to get cancer results.
So we are often faced with a sad situation where we receive incomplete request forms, where the doctor's not indicated that it is urgent or provided a history. And unfortunately, those specimens are then not prioritized. And that's where those anecdotal reports would come in.
Yeah, but for those anecdotal reports, for someone who may be given months to wait for a turnaround to get those results, of course, that is a dire scenario.
It is a dire situation, and that's why we have put together both a short-term and a long-term plan. So in the short term, we have reached out to the Department of Health, to the private sector to assist us. In the long term, we have put processes in place to fill our vacancies. We have started a pilot project of medical officers who are employed in anatomical pathology so that the specialists can then focus on the more complicated cases. We have introduced digital pathology with artificial intelligence. So we are working towards long-term solutions so that we are not in this situation again.
And, you know, I heard you also saying, just to alleviate people who are watching who may be concerned about this long turnaround time, that those cases that are prioritized are seen with priority. But what happens in those cases where, I mean, you are already short-staffed, where you've got priority cases that exceed your capacity?
So that's where we are partnering with the private sector, and that's why we will now be sending additional oncology specimens to the private sector so that patient care is not delayed.
This collaboration with the private sector, is it for certain provinces or is it nationwide?
So while we are talking specifically about Charlotte, this is a crisis that is facing the NHLS nationally. So nationally, we are actually sitting with 44 pathologists in the NHLS across the country. Charlotte is most affected because it receives the largest number of specimens. It receives about 42,000 specimens per year because it's receiving specimens from 15 surrounding hospitals. So where we can, we do refer work internally to our other pathologists within the NHLS that can accommodate our backlog. This is slowly becoming a national crisis.
Yeah, I was about to say, it sounds like quite the crisis if you're saying there's 44 pathologists nationally. How many, ideally, are they supposed to be nationally?
So it depends on the work volumes. But with that amount, what it equates to is that each pathologist would be responsible for seeing about 50 cases per day. And what would be expected would actually be 20 cases per day. So we're looking at half of our numbers, and that's what our vacancies are sitting at. We currently have a vacancy rate of 28 pathologists nationally.
And with this collaboration with the private sector, who's paying for those tests?
The NHLS are paying for the tests.
Okay, so it won't be the burden of the patient?
No, it's not the burden of the patient. The NHLS is carrying the cost.
Prof, thank you so much for your time and just clarifying what really is sounding like a bit of a crisis that's looming there, but also the solutions that you're putting in place there at the NHLS.